Now we are supposed to be at the most forward end of the evolutionary scale, but today we are going to discuss how restricted we are when we start doing something like operations on the human body. So we have reached a stage of evolution where we are stopping the process of further evolution. See, the biggest problem we have is the anthropomorphic limitation we have. We don't have a retractile neck. We don't have projectile eyes. So these are what are going to limit how we perform. So if you see, the whole ecosystem of our abilities is not to the task of performing surgery efficiently, but to make you efficient to perform the surgery. I want you all to understand this, because that becomes a big limitation, and that's where probably the innovations are going to help, and we have to learn and have the ability to accept these innovations to improve. But today we'll come to that at the end. How are we the impedance in the further improvements? Now, dexterity of the hand, they're talking about tremors, they're talking about failure when we have to do repetitive acts accurately. Now, next is a lack of perfection in repetitive actions. So this becomes very obvious as you tire. For example, for a cardiac surgeon, when he has to put about 100 sutures to fix the aortic valve, I mean, how the last sutures will be very different from the first sutures. Now, fatigability. Now, this is another big problem, especially for the surgeons. We are dependent on vision to be able to operate, and if that is defective, that compromises your results. Now, the haptic feedback is where all your confidence lies, and we have been discussing about the lack of it and the lack of confidence in the systems. Now, clouding of judgment. Judgment is a very important part of the surgical procedure. There are times when your judgment is clouded and you make a mess of the whole thing. So these are all the limitations, and now today we are working on how to overcome these limitations, and I would be talking more about how to overcome the visual limitation when we are operating. Now, this anthropomorphic limitation of our human structure will decide how you are going to position the patient. It is not that what is the ideal position for removing a particular tumor in the brain. It is how you can see it well. If you cannot see, it is termed as inoperable sometimes. Now, dexterity of hand and finger movements. Now, instruments are modeled to suit your hand movements, not to suit the task so many times. Now, the long hours of training and long learning curves are required to overcome the problem of achieving perfection and overcoming fatigability. I am sure neurosurgeons are an example of the quirks they are, that you don't sleep, you don't eat, you operate 10 hours, 12 hours, and still you have to survive. Now, dependence on vision for guidance is a big problem. If that's where we are different from the robots and all, where the robots can manage with the digital information, whereas we don't understand digital information, we need a visual guidance for it. Now, when you want to overcome this, there are the problems of magnification, the illumination issues, and then the chromatic and the spherical aberrations which come with the optics. Now, the haptic feedback is very essential when you are operating. Without that, you are lost. So therefore, the kind of material you use, the kind of material we use, and the instrumentation, everything has to be designed to suit the human needs. So we are prone to failure in stress, unlike a machine. And there is the human safety factor. Today we are talking about a white elephant of radiation to the patient, but we are very clear that we don't want to get irradiated, and if the radiation goes to that level, we would rather not operate or do the procedure. Now, how does new technology, does it really empower us, or will it totally change the role completely? maybe we will be out of the operation theatre. So let us see how it's going to happen, and we are on the road now. Now robotic arms have come. We'll see how good they are, and they overcome all the anthropomorphic limitations we have as human beings. Now, when you start modeling instruments to robotic arms, sky is the limit. You can use technologies which are not safe for humans. You can miniaturize to any extent possible. So now this is going to completely eliminate the first limitation of the human being. Now the learning curve is not required. Here to train a person to become surgeon, you need sometimes 5 years, 10 years. But it comes in a package, you open the package, use the instrument, there is no learning curve there. Now visual inputs can be acquired more easily. Cobos are safer. Previously, we had robos. Once instructed to perform, it will either destruct itself or it will destroy if there is an error. But today we have so many safety machines. The second there is something out of the plan, the robo just stops. It's become much safer. Now it's a stress-free environment. It will just execute without any stress. Now there's no restriction due to the human safety factor once you get into the newer technologies. So, what's happened? Oh. Okay, so I'll be talking just about one aspect, that's the vision, how it helps and how we can improve on it and what is the path we are walking upon. Now, optical microscope was a biggest invention of the last, I would say, a century almost, where the surgeon could see better. It improved his stereoscopic, it maintained the stereoscopic view, and it gave magnification, it gave good resolution, and then it gave the facilities of image superimposition also, and the fluorescence as we use in neurosurgery. Now this also has limitations because we have to use light source, the photons, to stimulate our retina. Now there are physics behind the functioning of the light. It has to be in a straight line. So all your equipment again gets limited. You can't turn around, you can't look around the corners. So access becomes restricted. So unless light reaches the target area properly, you cannot see. Now the movement of the patient midway is a disaster. So therefore, the way you anesthetize in neurosurgery, or this is probably more applicable to those areas than to spine. I'll come to the spine areas later. Now, there's an important requirement that the surgeon needs, and sometimes the positions are very unsafe for the anesthetized patients. We are doing in sitting position. We are doing in prone position where the tube is coming out. So, but that is dictated because you are using a microscope. Now, inoperable locations, that means you cannot approach the tumor. Ergonomics, then the need for repeated adjustments, the number of times the neurosurgeon changes his position while operating amounts to 200 to 300 times in a period of 2 hours. That is what has been calculated. Now the sterility issues are there which come with it. Now exoscope is a step where we try to overcome these limitations of the microscope without losing the benefit of a good vision. Now exoscope, the term, there is a lot of confusion whether to call it an exoscope or you call it a digital microscope. Exoscope initially came, I think Karl Storz started when they just connected the camera to the one tubular device and projected it on the screen. Now from there it has traveled a long way. So today we call it the digital surgical microscope, where you have all the benefits of a microscope on a digitally manipulated image. Now it retains all the qualities of a good image. It has three-dimensional projection, it has magnification, it is compatible with fluorescence, and it has got a holding arm which takes away the neurosurgeon's requirement to leave his hands to adjust the microscope. Now this is how an exoscope is finding a better use. Now there is something you may lose in this, that is there is a proprioceptive support we need when you use the microscope. You know, when your eyes touch the eyepiece, you're getting a feedback. Now this is something which you have to learn to do without when you're using a exoscope. Now this is it's a disclaimer. I'm not representing them, but I'm using that equipment, so whatever I'm saying is an experience coming out of that. So let us try to understand what is the difference, because whenever you introduce, as the previous speakers have told, a new equipment into your workflow, are you doing it for the hype of it, or do you really require it? To know this, you should know a little bit about, I mean, why is it advantageous, or is it just cumbersome, another piece in your OT? So basically when we look at the microscope, these are the components where you have a central main objective which collects the light, and then you have a turret where the flow is guided, and then you have the eyepieces where the magnification occurs, and then you have those beam splitters which give you inputs. This is a microscope. But when you come to the exoscope, after the collimation occurs, that means once the light is collected, everything is digitized. Instead of projecting to the retina in the eye, it is projected to the sensors. You will understand it better when you look at these images. Is there a pointer? Okay. So here what is happening is, this is where the objective is. Now light rays are coming in. Here they are divided into two columns, and here we have prisms where you invert the image again, and then they are connected to both the eyes. And from here, this is the source where the light is directed into whichever other outputs you want to give. And here the light is coming from the side. Now this is the construction of the camera, but when you come to the exoscope, from here onwards there are two sensors which will directly receive the light, and whatever happens is happening at a digital manipulation level. Okay. Now that has advantages because the technology is superior compared to the technology we have where we see and perceive in the brain. Now this is what happens in a exoscope. So instead of light reaching the eyes, it will go to the sensors. From the sensors it's picked up, and then the processing unit will display it as two images superimposed on a screen. Now when you use the goggles, they fuse the image and give you a stereoscopic perception. Now one more advantage is this light which is coming from the side. Here the light is all around. So it's a coaxial vision. It has a lot of benefits to avoid certain spherical aberrations and then some scatter effect and all that. So the difference becomes this. You are no more bothered by this cumbersome thing. The exoscope part is, the oculars are removed completely. And here you are seeing already a processed image on the screen at your convenience. You don't have to be connected to the optical oculars to see. So that means your neck and head are free to see the image. It's like having floating eyes. Now that is the basic advantage which comes by using an exoscope. And it's very painful even to do a minimal movement on the microscope. Your whole body structure, your ergonomics is being stressed, which does not happen when you are doing an exoscope. So this is the point. I mean, basically I am just repeating the same things. So you don't have to be, you are not stuck to the optical piece. Your neck becomes comfortable, your head position is easy, and what happens is, to change your view, you have to change the whole contraption. Here you don't have to, and when the contraption moves, your head moves, your eye moves. Here by moving the headpiece, your eyes are watching the same, your head and neck position are the same, you can avoid an obstruction, like it could be a retractor, it could be the instrument of the assistant which is coming in the way, you can just move the eyepiece without moving your head and neck. So that's a great advantage. And the best thing is four hands technique. It can easily be done when you are doing an MIS. When you are doing a 1 centimeter incision in the cervical disc or a lumbar disc, what restricts us? You cannot have 4 instruments there because 2 of them will restrict your view of vision because you need straight vision. Whereas when you use an exoscope, you can position it in such a manner and then you can see the suction, the kerosene can be working, and you can have a number 4 also working there. So this is the comfort we have when we are using the exoscope. And the screens can be positioned at your convenience and there is no limit to it. Whereas in a microscope, if you are using too many channels, it is diluting the amount of light which is coming and your vision, the surgeon's vision gets restricted, which does not happen in an exoscope. That's a great advantage. Now the robotic arm adds a great convenience. This is what makes a hand-free movement of the head end of the exoscope to enable you to see better. Now these are all the various joints which are there. This is the technique, how much each moves. But the basic, in one line if I were to say, this takes away the stress of adjusting the microscope when you are operating, to the extent that you can assign the movement to somebody else. As you are operating, if you have a resident who is there, he knows immediately your hand is coming in the way, he will tilt it. You don't even have to tell him. And maybe later on it can be auto-programmed. If some interference is coming, the machine will move itself. So there is a lot of things are happening. As I am talking, probably they are removing this and using something else. So the same points I just gone through one by one. And this becomes more important when you are using a C-arm, when you are using other equipment which is in the OT. Now waypoint is a very interesting function which I am sure most of you are familiar with. Like if you have to move it, it will come back automatically to the same position where you are operating without any human interference. So this is a great advantage. Now target locking is a great thing. This is how once the exoscope is locked onto the target. Now when you are operating, you want it to move. You have a foot control by which you can tilt it. It moves without losing the focus, without losing the target area you are operating. That means as you continue to operate, you can continuously move the headpiece. You don't have to stop. In a conventional situation, what happens? When you are operating, something comes in the way, you have to leave your hands, go adjust it, it takes a while, by which time you have lost your focus on the surgery you are operating. Imagine when you are operating on an aneurysm when there is a bleeding. You see, suction is on, you are seeing a clear field, but you can't see at the corner. So you have to leave the suction. You go, by the time you put it, again there is a pool of blood there. Again you have to reorient yourself. This takes a long time for the surgeon to continue to operate. Whereas that's totally overcome by this. You don't have to move your hands. Just by the foot, you just tilt it, you see where you're seeing and you continue to operate. So it's a great advantage that way. Foot control, as I explained to you. Now screen positions, they don't, anybody can stand anywhere. You can adjust the screen positions. Now superimposition, which is already there in the microscope also. So this is not a new invention. So it can be continued with the exoscope too. Now I just want to show you, now the microscope, if you want to, normally if you see the pathologist working, he stands on the eyepieces and work. For a surgeon to do it, you need so many contraptions just to make the alignment straight so that the surgeon can see straight. To get into this position of operating, so much is required if you are using a microscope. It's so cumbersome, and exoscope does away with all these things. Now this is a big problem when you are using a microscope. Now you want to see a thing clearly, light. But sometimes you need more light to see clearly. Once there is more light, there is scatter effect and you lose the depth, you lose the detail, you lose the resolution. Now to overcome that, you want to decrease the light, this is what happens. The resolution is gone. Whereas in an exoscope, there is an algorithm, and because it has done away with the magnifying systems, so it can give you a clear picture with all the benefits. Now this is what happens in a typical situation where this is an aneurysm being clipped. This is the aneurysm clip and this is the aneurysm. There is so much of blurring all around. You lose the depth, you lose the clarity. And this is in a deep situation, so that if you try to increase the light, then you can't see. Then what happens? You increase the magnification. When you increase the magnification, the clarity is gone, the depth is gone, the resolution becomes poor. Now these are all the issues because you are light dependent. So exoscope, what it does is, it changes the workflow of the light, and it, because of the light sensitive HDR image sensors and the design, and they have got an algorithm, because of that it overcomes all the problems and gives us a better image. So this is how the depth of field is. Now this will be overcome. If you use an exoscopic image, you will see it, you will see the whole field clearly. So this is how it is. You want to see the whole, but you are only able to see the leg in case of a microscope. But this is what the exoscope gives you. Now it is quite safe, and it is 2 to 3.5 times higher. Now the problem of reflections. This is what happens. When there is too much light scattering, your clarity of the object becomes less. Now this is what happens. Now you want to see, the light is too less for you to see the object clearly. Now this is overcome because of the positioning of the light source. Now the next question is, when you see in a microscope, you are seeing a circular image. When you see a circular image, then you don't see the area, the periphery is not seen. And especially when you are taking your instruments in and out, there is a lot of damage which occurs. You may be hitting the cortex because you are not seeing what is happening to the instrument as it is approaching the target area. So this is a great advantage when you are using an exoscope. Now coming to magnification, one is the optical magnification you get here. In addition, by changing the zoom, then you change the screen also. When you change the screen, you get almost 100 magnification. So this is what happens. When you are seeing a circular image, you can miss out many things which are around, which are happening, and you will not realize it. Now circular image is a disadvantage, and when you are using a microscope, the other people are only seeing this area, whereas the surgeon is seeing the whole area. So there is a discord for the assistant to help you. So all of them summated here in one slide. So these are the advantages. But one basic difference we must all be aware of. In a microscope, you are actually perceiving the light and the image which the light is projecting on your retina. Here it is a synthesized image. Now we all use iPhones. We know sometimes when you take a photograph, some clarity is better in your phone than what your eyes are perceiving. Now this is an advantage, but there is also a disadvantage that, you know, if this processing gets, if there is a failure in the mechanism, it can be a big problem. This is what I think, it is my thought, we have to check it out. You know, for example, if the color aberration starts in your technology, then it can create big problems, like a vein and artery differentiation when you are doing an AVM surgery. You know, these things, with an optics, this is not going to happen. Now this is the robotic arm, a Kobo. It has got a built-in safety function, where if it is coming too dangerous close to anybody, it stops. You have to be sensitive enough to wait and watch, don't push it. Lock on target is a thing I explained to you already. Now these are the robotic movements which are so precise. If you have to adjust, it'll, you know, you do a overcorrection and then settle on an area. Whereas a robot doesn't do that. It's got sub-millimetric precision and it's a pleasure. This is one thing which you will all become addicted to when you start using an exoscope. So image quality is better. You get 95x magnification in this, 10 of which is the optical zoom. So it makes minimally invasive surgery even smaller. In fact, in neurosurgery, now we talk about ultra micro neurosurgery. When you go into the cavernous sinus, you know, when you're dissecting around the carotids or around the perforators, so you're much more safer. Now the digital aperture, this is an advantage. Sometimes if there is some reflection, you can take a circular aperture in the exoscope. So the best thing is the orientation is the same, whereas those who are using a microscope, you know, the assistant will not have the same orientation. He'll have to readjust. Okay, now you can stand straight and operate. It's so relaxing. It's an ergonomic advantage. Now we have to ask this question, is it a tool that really enhances surgeon's ability, or is it just another tool we are trying it out? So here I would say it is a definite advantage, more so for a neurosurgeon who's going in smaller, deeper fields. Now we have to ask a question, how useful is it in the spine? Is it useful or not? I think it is useful. I'll tell you why. Now image quality is better in the working depth, because when we are doing minimally invasive spine surgery, what is the limitation? The limitation is because of the size of the incision and the direction, the amount of light reaching the target area is so less that it compromises on the quality and it interferes with your safety. And best thing is it removes the need to stick. I think all these points I have already mentioned to you, so there's no point repeating them. So you can go smaller, you can use more hands to operate, your image quality is not compromised. That is the basic advantage of using it. So basically what I find is, at the stage I am in, I am old, my spine is more stiffer, and I am more into teaching, and I am anxious when a junior is operating. All these will be overcome. I overcame them when I started using exoscope. I have not done many cases, I have done about 30 cases on this, because when I joined the institute, I got the tool to play with, so I am enjoying it. What I find is, at my stage, you can make, today in the second session, I'll be showing how my PG does a anterior cervical discectomy, and you're so comfortable. What happens as a teacher when your junior is operating? When he goes into a dangerous area, you have to move him out. You go take over and show him how to do it, and he is again coming back and trying to do his experience. Now this you need not do, because he will continue to be there. You go in with your instrument, you show him what to do. Without changing anything, it doesn't take time. So I think it's a better teaching tool when you are teaching hands-on to your juniors. Now second thing is, you can sit or stand comfortably and retain and have full control on what is happening in the field. And for you also, you're not stressing your neck, the positions are no more difficult, and you're not stressed out. So it's a great advantage. So for a surgeon, we always curse, the tools are terrible, the tools are terrible, I wish we could do better. But what you have to watch what you wish for. You remember the joke, a chick with two legs? So that can happen to you here also. Here you're a big man now in the OT, you know, everybody respects you, but when you wish for such a tool, the tool will come and probably it does things better than you, and you will be relegated to one corner. Now I think we should be prepared for this. But the basic thing is, we have to reorient our philosophy. Today we have a tool which is performing better than you. How can you control that tool? It's like the head of the department who's very scared. Now he has a junior who's more efficient, more dexterous, and he is willing to do things. You become an interference in the process of the growth. It's like a father who doesn't know how to swim, trying to teach the child to swim in water. Now, we have to realign ourselves. We should learn to let the robot perform and just monitor there so that it doesn't do any harm. But if you see, like somebody was talking about, robots are using to do telesurgery. Why? Why telesurgery? Patient can come, you can go. What are you what is it? It's only that we don't want to give that control. You want to use the robot and you want to operate. I mean, I feel at a personal level I am having this conflict. So I think instead of fighting with it, we should learn how to use it as a slave and get the maximum out of it. To stick to the eyepieces. Without that you cannot see. That means you have created a whole block of metal before you to see the target area.